AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard Incorporated. It's just one really great, good organization that helps people. Our phone number is 473-7770 to talk to Kay, our information specialist. And before I even say anything about our sponsors or introduce my panelists today, I want to tell you about a phone call we got this morning. The phone call came in response to my article that just appeared yesterday in Hometown News. The lady called Kay, 89 years old, income roughly $1,500 a month. In the process of talking, she asked a question. Kay asked her a question about her status. She's a widow. Her husband served in World War II. She did not even know about the VA aid and attendance program. Based on her condition and her income and her assets, we already know she is eligible for $1,400 of additional income a month to help her live. Now, wouldn't you say that that's a good reason for having a program like Helping Seniors? You tell me one other single organization in Brevard County that is going to provide that type of information based on a phone call, just talking to somebody about help. The person said she needed financial help. Kay started talking to her, found out about her status, gave her direction. She called us back. She's got an appointment with the VA next week. Now, folks, that is what is meant about a nonprofit organization helping people. And that's just the start of what we do through Kay. So, but I want to talk about today, I'll mention my sponsors first because they make all this possible. Kindred In Kind Hospital and Health Services is a major sponsor. The Eye Institute, Solid Bite Dental Implant, represented by Dr. Lee Sheldon, who is my panelist today, and we'll get to the show in just a second. Bill Johnson, elder law attorney. And if you look in our newest issue of Senior Scene magazine coming out, we gave Bill 2 columns plus space in the paper newsletter because there's a column in there on Medicaid planning. Extremely important for you to understand what's in that paperwork about what Bill says. He has condensed his seminar into 2.5 pages, and I give you my word, if you read it, you will find information that will help you in your estate planning. Simple, but it helps. The other sponsors include Woodstock Hospital System, WMEL AM 1060, this radio station, Levin Home Care, Atlantic Shores Rehab Center, Ebony News Today, and Wendy Handy of Dale Sorensen Real Estate. So let's get to the show today. The phone number here at WMEL is 631-1060. I got it right, Vince? He's not hearing me. 631-1060? 241. I'm sorry, I went wrong. The phone number, folks, is 241-1060. 241-1060.
Area code 321-241-1060. There you go.
Hey, Vince, that was an announcer voice, too. I love that.
I make a mistake every once in a while. But I didn't make a mistake when I asked Dr. Sheldon to be...
You did make a mistake, or you didn't make a mistake?
I did not make a mistake.
It's been a long time since I've been on, Joe. I figured there was something I did wrong.
It is not. The only reason you haven't been on is because you've been too busy taking vacations. But no, I'm not kidding. Lee and I have been doing radio and TV. It goes back. I first did my TV show with Lee on his TV show in 1994.
Okay, yeah, because I started in 91, so yeah.
94,
yeah.
93 or 94. So it goes back a long way. But Lee is one of the original sponsors of our program. He's still with us. one of the things that
can I make a correction?
Yeah, go ahead.
You're calling us Solid Bite Dental Implants, and we're going to change that name right now. We're going to call Dr. Lee Sheldon as the sponsor, and I'll tell you why. Because we're no longer, nor were we ever, just a dental implant place, and I don't want to give a misimpression. At the time we first started, I was a periodontist, and we do a lot of dental implants in this county, and so we wanted to feature dental implants. But we have two specialists, Dr. Furtado and myself, as well as my son, a general dentist, and we do full-service dentistry in our office. And so let's broaden it. We can talk about Dr. Lee Sheldon. We can certainly talk about our office, but our office does do everything in our office. So,
are you going to change the name?
I'm going to keep the name Solid Bite because people recognize it. But we've even changed the way we're answering the phone. We used to say Solid Bite. We did that for the last year. And then people would say, is this Dr. Sheldon's office? So we've gone back and we've said, we're now answering the phone, Drs. Sheldon and Furtado's office.
That's right. You're answering the phone now?
Yeah.
So if I just say Solid Bite Dentistry.
No, I'd rather you say Lee Sheldon because more people know me than know Solid Bite.
Oh, okay.
Yeah.
Okay. All right. Okay.
Is that okay?
So we're going to call it Lee Sheldon.
That's good.
Orthodontist?
Dr. Lee Sheldon, periodontist.
Dr. Lee Sheldon, periodontist.
That's right.
So today, the topic
Is it time for the break?
The topic we picked for today, though, Lee, fits right in with what you, Matt, and Dr. Furtado are doing.
That's right.
And we're going to talk about facial pain and what it is, and toothache pain.
Yep.
And it got a couple. What I did, folks, I took Dr. Sheldon's second book, the Expanded Ultimate Tooth Manual, and I've marked 4 things in there. And one, I'm a little upset with Dr. Sheldon because I've been suffering from fibromyalgia for a long time, and he never mentioned to me the one thing he's got in the third from last chapter in the book about Nexatrine, or what is the name of that stuff?
I'm not sure. I'm not sure what you're referring to. I better look at the chapter of my own book.
I got it right. I got it right here.
Would you read my book to me?
It's called Low-Dose Naltrexone.
Oh, Naltrexone, yes. LDN.
Naltrexone.
Absolutely. LDN, correct.
Well, we're going to talk about that afterwards, before the end of the show, because I think this is important for, folks, one thing that Dr. Sheldon has done, he does regular dentistry, but he goes to different wellness centers. He goes to different places. He goes to seminars conducted. When you went to one in Spain.
Yeah, it's great.
But he learns about what's happening in other parts of the world and tries to bring those to Brevard County, Florida. And I read in his book, Lee is very careful in his book to say that some of these medicines these treatments are still undergoing research, and before you make any changes to your medical treatment plan yourself, you should talk to your primary care doctor. That's extremely important. But what Dr. Sheldon has done in his book, he's pointed out things that you need to ask questions about. And I think, Lee, that even when we're talking today about facial pain and toothache and everything, there's a lot more with the Internet and all the questions that people are starting to ask about treatments and why we do certain things. It's more important for people to understand what you're going to talk about.
Well, it's true because there's so much confusion that goes on once it comes to the mouth. As a matter of fact, on my way up here, a dermatologist from Sarasota called me to ask me for some advice. Well, how did the dermatologist from Sarasota know? The dermatologist happens to drive to Orlando periodically and saw my daughter and found out that my daughter that my daughter's father and my daughter's brother were dentists, and so he had a special problem that had been going on. So he asked my daughter about it, and my daughter said, why don't you talk to my dad? So he and I were talking about a diagnostic problem. He has a problem of pain in a tooth area that's been treated. It's been treated quite a bit, and he's trying to figure out what to do. And so we started talking about what needed to be done. He's had varying opinions, and so we talked about what could be done and what could be there. And it's one of the questions we're talking about today. How do you differentiate between a toothache, a nerve ache, a crack in the tooth, or something else. And we were doing the diagnosis on the phone. I had him reaching around, reaching into his mouth, touching different parts of his tooth in order to be able to come up with a diagnosis. And asked him to go see. He was willing to drive over here. I said, you don't have to do that. I knew a good periodontist in Sarasota. And so I told him to go see a periodontist in Sarasota with the information that he gave me, and the periodontist will be able to help him.
See, that's what's so important. That's why, Lee, that's exactly why I mentioned the case of the 89-year-old lady that called Kay to start the show.
Yeah.
She did not know about the VA aid and attendance program. And just think about this for a minute. We state that there are 87,000, and I've heard that number, and I've heard 75,000 veterans living in Brevard County.
I'm one of them.
5,000 is served in World War II. Year one. 5,000 veterans from World War II. We don't mention the widows.
No.
And see, a widow, if she is a surviving spouse and has not remarried, if she falls in certain categories and has certain activities of daily living or requirements that she needs to have to help her live, she becomes eligible for an additional VA pension.
And the VA doesn't tell her that. They don't volunteer the information to her.
They don't call
when the husband dies.
No, they don't volunteer that information. They send no information out on it. They don't tell anybody a darn thing about it. You have to find out. And word of mouth only goes so far. The same thing, but word of mouth does help, because if somebody is hearing you and me talk today about facial pain, the nerve centers, toothache, and all the problems that we will discuss, it may not be something that bothers them, but many times they have a friend or a relative that's experiencing a problem, they know about it. So there's a chance for people to find out how to get help.
Yeah, absolutely right. And one of the, and by the way, you would figure a physician in Sarasota wouldn't have to call a dentist in Brevard County to get the answer. But in fact, there are certain people who are more likely to be able to give answers. That's what Helping Seniors of Brevard County does. And so all you have to know is Helping Seniors of Brevard County, and that's a source of information, because all of the other information is filtered in through you and through Kay, and so all of the information is right here. And at Helping Seniors of Brevard County, do we do something? Absolutely we do. We direct you in the right direction so you can get the help you need. It's kind of cool.
Yeah, I keep saying, Lee, that you can't solve all problems, but that's not really true. See, a person may call with a specific problem, and we may not be able to help with that specific problem. We help solve the problem of them being afraid to call or not knowing who to call. At least one of the common things that comes back to Kay after a phone call, and people will call, and I pick this up because I get all the messages on my computer. People are very appreciative of the fact that she takes the time to try to understand what the problem is.
And Kay's been around here for a long time, too, so she knows the area and she knows the territory.
It makes all the difference in the world. Information and education are so doggone important. But let's talk about what we want to talk about for a minute. And let's just start with facial pain. A lot of people get ticks in their face. They get pain in their jaw. They get headaches. And, sometimes I get... I understand what you're right, but sometimes I don't understand why the root cause of the problem can be so simple.
Yeah, it can. And frankly, there are times when, again, talking with this physician today, he says, I get no training in dentistry in medical school. I don't know a thing about the mouth. He wasn't even able to identify what the tooth was that he was talking about. And so if we start getting wrapped up too soon, particularly when we have a pain in the mouth or even the face, if we start to get wrapped up too soon into medications, when in fact there may be a true diagnosis that's a dental diagnosis, then we may be masking something that in fact can be treated. And a lot of these pains that we have in the face can be directly related to teeth. I told you one time, it's been probably 3 or 4 years ago, we talked about a statistic here. And the statistic was failed sinus surgery. Remember we talked about that?
No, I don't.
Okay. So failed sinus surgery, you have a chronic sinusitis. The surgeon does the surgery, whatever surgery is done in the sinus, in order to try to correct that. For the most part, those surgeries work. But some don't. And so they went back, and of course, these days, and for the past 20 years, CT scans have been taken of the head. And so they went back and they looked at the failed sinus surgeries. And instead of looking at the sinus, they went down a little bit to look at the end of the tooth. And they found out in something like 74% of the failed sinus surgeries, the reason they had failed was because of a dental abscess that was undiagnosed.
An undiagnosed dental
Undiagnosed dental abscess. And frankly, some of these people, some of the failures had been to a dentist, but it hadn't been diagnosed. Why? Because with a traditional X-ray, sometimes we can't see an abscess in the X-ray, but with a CT scan, a dental CT scan, we can. And so here, 74% of them were failed, and they figured it was a failure, and then they just looked down and they said, even on a regular medical CT scan, we can see an abscess. They then, as a pilot experiment, treated some of those patients again by extracting the tooth. And the sinusitis went away. So why is that happening? Because the ends of the roots of the upper teeth, particularly the ones in the back, are located right within the sinus for most people. And so if there's an infection in the root, the infection will travel up the end of the root, put a hole in the sinus, and cause the sinusitis. And because the tooth is chronically infected, it keeps on feeding bacteria up there. So no matter how successfully the ear, nose, and throat specialist might treat the sinusitis here, it's still being fed by a dirty tooth that's located within the sinus.
Is that somehow related to what a lot of people call nasal drip?
Postnasal drip can be an allergic problem. And no, it wouldn't be postnasal drip because you wouldn't be getting surgery for that. We're talking about sinus infections, full-blown bacteria in the space below your eye and lateral or medial to your cheek.
But, we've talked about this on our radio and TV shows. What you're talking about, sinus infections, they can be... Actually, in the case of certain patients that have heart conditions and somebody, these can become more magnified as being a potential problem area if they're not left untreated.
Oh, I think anytime you have a chronic infection in the mouth or a chronic infection any place, it can affect any part of the body, yes.
Well, that's my point.
Yeah.
People don't often associate infection in the mouth with the problems or potential problems that could cause throughout the rest of the body, like it do if you have a cancer problem or if you have an infection in the back from an operation. You can get the same reaction by infections that are in the mouth if they're not treated.
Yeah, for some reason, and it probably goes back to the fact that dentists are the only ones who are trained to treat dental problems, and physicians aren't trained in dental problems. That there's a divorce, and there's medical insurance doesn't cover the mouth, or however you look at it, there's a little bit of a divorce. Now we're getting better at having cooperative relationships between physicians and dentists, but still, it's kind of like a lack of knowledge thing, and so it becomes more important for the patient to have some understanding as to what's going on, so the patient can sometimes direct his own treatment, or at least see a competent dentist in order to be able to get the diagnosis made.
I paid a visit to my podiatrist a couple of days ago.
Yeah.
And I asked him a question about accountable health organizations. He said, Joe, they've been around. He said, but there's a lot of problems with them. And I was trying to listen to him and try to understand some of the problems. And I was very happy to tell him that CMS Medicare has just been authorized $44 million worth of money to give out to 44 different organizations throughout the United States under a new program to to relate to medicine, the practice of medicine, and connect the social aspects of medicine along with the diagnostic part of medicine and in relation to primary care physicians and what happens in the hospital, trying to make the whole thing work better so that there's less of a tendency to return a patient to the hospital, and trying to figure out how the social interaction and the knowledge that people can get would help prevent this added cost. Ironically, the 3-track program that you're talking about is exactly what we started with helping seniors 5 years ago. And it's my question to you would be, since we do all these initiatives, it would seem to me like somebody along the line would have recognized the importance of the dentist to overall health care and involve them in some of this program. And if that is something, as we put this thing together, it might be beneficial for you to be part of what we're doing.
Okay.
So it's just.
I think, first of all, it's something that I would welcome. There is a need for. I mean, one of the things that you have told me since I became your guest, 3-4 years ago, maybe it was about 3 years ago, is that there is something that dentistry offers that you haven't been able to get from the other specialists, and you would expect that because, we all bring our skills and we all bring our knowledge to the table. But you and I have talked, and as a matter of fact, the Ultimate Mouth Manual looks at that. It doesn't just look at, I've got a toothache, or I need a crown, or I need a dental implant. I spend a good deal of time in that book talking about the interaction between dentistry and medical problems. But
this is the point, is that a periodontist brings something to the equation simply because of the way you look below the gums and the methods that you use and the different things you have for treatment. I can't believe it. We're at the half hour already, Vince. Anyway, okay, folks, I'll take the mid-show break, and I promise I'll let Dr. Sheldon talk more on the second half of the show because I do want to talk about facial pain, and let's get interesting. Stay with us. We'll be with you in about 2.5 minutes. This is Joe Steckler, folks. We're back live with the second half of the show with Dr. Lee Sheldon. I'm going to quickly mention my sponsors for the second part of the show, who include Senior Scene Magazine, Hometown News. Get the new issue. I got an article in there about organizations in the county that are supposed to help people, and you'll find out that these organizations do get federal care dollars to provide services to you. You should know about it. You should know that this stuff is there available for you, and many people qualify, but simply, again, don't know about it. Helping Seniors is there to complete the care equation, not compete with anybody. Complete is the correct word. And the phone number is 473-7770 to reach Kay. The other sponsors include Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney from Braswell Courtney Financial Advisors, Barbara McIntyre from the Home Equity Specialist. And folks, with all that's happening right now, you need to know more about what a good home equity loan specialist can do for you. There are good ones and there are bad ones, just like anything else in the world. You got to get to the right ones, and the ones we recommend that you talk to, you're going to get a fair shake from them. The other sponsors include Canadian Meds of Melbourne, Wiederman Malik, Vitas Hospice. Our website, folks, to get all this information and to get the radio show that Lee and I are doing today, you'll get it tomorrow on our website. It's helpingseniorsofbrevard.org. helpingseniorsofbrevard.org. During the break, folks, we were talking about a doctor that's written a book that's extremely good on healthcare, and in fact, the doctor is going to be speaking here in the Melbourne area next month. So I asked Lee to talk a little bit more about it because he knows more about it than I do. Go ahead, Lee.
Yeah, Dr. Michael Greger, Greger, published a book. It just came out last month. It is selling like hotcakes. And get the title of the book, Joe. How Not to Die.
How Not to Die?
How Not to Die. And what Dr. Greger has done, in really layman's language, has put together all of the nutrition, studies that are in the medical literature and has put them in a sequential order where you can look at a particular disease you're trying to avoid getting sick from, and here are the studies that show it. And it sounds really dry, but he's made it so entertaining. He's made it so light, and he's made it make sense to the layperson. He runs a he runs a website. It's called nutritionfacts.org. Nutritionfacts.org, and nutritionfacts.org, which gives you all of the information that's available now on nutrition. He's had that website for a long time. He just published the book in December. He's going to be here in Brevard County in February. As a matter of fact, he's going to be here in Brevard County on Tuesday, February 23rd at 6:30 p.m. It will be at the Cocoa Civic Center, and the organization sponsoring him is Healthy Planet of Brevard. There's no charge to go, and I would encourage you, because I've heard him speak, I would encourage you to get out to the Cocoa Civic Center at 6:30 p.m. on Tuesday, February 23rd. Go. You're going to hear a gem of a lecturer, someone who really knows stuff and can communicate it very well. So you'll have to go to the website, Healthy Planet of Brevard, in order to be able to make reservations. But by all means, do so. I made reservations for myself, and it's filling up so fast. I have the guy of this caliber here. I've actually downloaded the book. I was listening to it on Audible, which is what you can, it's a book on tape type of thing. Right. And it's just been fantastic. I'm almost done with it.
What is one topic that comes to mind right now that he talks in a book that you could relate in a short story to the listeners?
He has topics, for example, how not to die from cancer. He talks about how cancer has been reversed in people by taking certain actions themselves, which they can do themselves. He's talked about it in terms of heart disease. That's how important it's been, and he showed the studies that document it.
There are things you can do with regard to heart disease to reverse the ultimate effect of heart disease. I think that might be easier than with cancer.
It may be. He was talking about both, and
Drugs?
the studies there that were no, it's actually how to eat. It's actually nutrition based, and this is a physician. It's an MD, and he's talking strictly about nutrition.
Okay. Well, one of the things that you had in your book, if I remember correctly, was the talk about people taking magnesium.
Correct, and we've remember when we did that, I published that article in Florida Today, and the store sold out of magnesium the next day. That was pretty good, but magnesium.
Well, why is magnesium? So I bet you a lot of people listening don't know what we're talking about. Why is magnesium important for people to take?
Well, most of us are deficient in magnesium, and so if we're deficient in magnesium, therefore we don't have an essential mineral that we all need. What does this mineral do? Well, one thing the mineral does, or when you don't have that mineral, it may cause your muscles to seize up and you've got this muscle pain. And you can't figure out, why do I get these cramps? Well, because you're deficient in magnesium in your system. Magnesium has an interesting side effect, though. Magnesium acts as a diuretic. You know how we take diuretics to reduce blood pressure?
Right.
It's a natural diuretic. So while we're taking something that we need that's been removed from the soil and we're not getting it, it may very well help us in other aspects of our lives.
Could magnesium deficiencies be related to what we're talking about, facial pain?
Absolutely. If you have listen, I feel it myself. I know it personally. My jaw muscles cramp up. My jaw muscles will lock up if I don't take magnesium. As a matter of fact, the best preparation of magnesium that I use right now, in fact, it's the one that works the best for me, because sometimes I forgot to take it, is something you can buy in any health food store called CALM, C-A-L-M.
C-A-L-M.
C-A-L-M, like calm, like calm down, like calm down.
Okay, calm down.
And so calm works. Why is it called calm? Because you know how when you're trying to go to bed, sometimes just things, you just don't feel like falling asleep, and things are racing through your mind and that type of thing? You can take Calm an hour before you go to bed, and for many people, they'll go right to sleep. My staff takes it. Of course, what's going through my staff's head is everything I've said to them all day, but they take Calm at night in order to be able to get rid of me. It's pretty good.
What is the danger, Lee, in people that are on a lot of medication if they go out and take things like you and I talk about on the radio? Stuff is sold over the counters, like taking Calm. If a person listens to us and says, I'm going to go try that, should they talk to the doctor before they take something like that? I
don't hesitate to recommend talking to the doctor. Any doctor would have to really come up with a good reason why you shouldn't take magnesium, particularly when we don't have enough magnesium anyway. I mean, this is something where 90% of us are deficient in magnesium. So I'd really have to understand why a doctor would say no, and there perhaps are some reasons. But
so what you're really saying is there's more that we can do to help ourselves that we're not doing.
That's right. And frankly, this Dr. Greger lectures and this book, How Not to Die, is going to tell you a lot of those things.
Well, that makes sense. And we were talking about facial pain. We talked about joint pain, muscle pain. But
now let's talk about muscle pain a little bit more, because we talked about muscle pain with regard to magnesium. But muscle pain is also called TMJ. You have this pain in your jaw, which sometimes will go down your neck, into your shoulder, or down your back, or it'll go up into your scalp, or up into your temples and give you headaches. There's an interesting thing about TMJ that we discover from time to time. If you have a toothache, the toothache is not so bad, but you're just trying to avoid that tooth because you don't want to chew on that particular tooth. So what do? You move your jaw to the side just a little bit. Well, for some people, that puts the jaw out of kilter and causes all the muscles that control that jaw to go out of balance. That in itself can produce jaw aches and headaches. So still, it does go back to the toothache. Treat the tooth first so the jaw can go into the right position. So rather than trying to avoid it and shifting your jaw to the side a little bit, your jaw will go in the correct position again. Part of the diagnosis of TMJ, of what TMJ, because TMJ only means temporomandibular joint. It's like saying elbow. It really doesn't mean anything.
It's part of your jawbone.
It's where the jawbone joins the skull. It's where the hinge is. Yeah. And most often, while you may get clicks in your jaw when you open and close your jaw, usually those clicks aren't painful. But it's the muscles all the way around those joints that do become painful. They do become sore. And so if you're getting chronic headaches, for example, and you're taking headache medication, it may very well have to do with sore muscles, and those sore muscles can very often be taken care of with the very simple dental appliance that a dentist can make for you.
What were you talking about when you mentioned earlier, you said something about pain from the neck or referred pain from the neck? What did you mean by that?
Well, we all have difficulty, I'm talking about as physicians and dentists, totally diagnosing and figuring out where a problem is coming from. For example, let's assume that your cervical vertebrae are a little bit locked up, that they're not really turning correctly. The cervical vertebrae, therefore, will be splinted in place by muscles that are holding it in place. Well, the neck muscles are connected to the jaw muscles. And so a neck problem can very often be reflected as a jaw problem. Well, we treat the jaw problem, but the neck problem is still there. We go to a chiropractor, and the chiropractor will correct the neck problem, the jaw pain goes away. So we've got to be careful in our differential diagnosis, knowing exactly where the problem comes from, and once we can find out where the focal point of that problem is, we're in a better position to treat it right the first time.
I'm going through therapy for my back again and for the fibromyalgia, and going through this, they're finding those the sore spots where the nerve endings are in
trigger points.
Yeah, the trigger points.
Yeah.
And these nerves in your neck and your back, some of them are anywhere from 2 to 6 inches long.
Yep.
And where they connect, if your posture is not right or if you're not walking right, and when you put them in a different position, you pinch the darn things, and it causes tremendous pain. And my therapist gave me, it looks like a shepherd's thing that I can hold it in front of me and it hooks around behind my back and I can lever this thing to get into those pain spots and massage them. I can't do it with this thing. I can massage those things. It sort of relieves those things, and if I could then stay upright, and I was, when you were talking, I would notice my posture sitting here, and I was trying to sit up straighter so it doesn't bother me. But there's so much that we need to learn about the neck, the back, and how all this stuff is connected.
You know, I've been fortunate to have been here for 35 years. And I've met some outstanding physicians, chiropractors, dentists, physical therapists, now an acupuncturist who I'm really very happy with. We've got some good people in Brevard County who can help you with regard to pain. Chiropractor that I've been seeing for a long time is Dr. Michael Villi, and you know Mike.
I know.
And Mike has done some tremendous things. You know, a year ago this time I was flat on my back. You know, I had 2 herniated discs, and through the efforts of Dr. Villi and Dr. Don Vliegenhart, they got me back to functioning again without having to go through surgery. It was really neat what they did. But there was, and Mike has a fantastic physical therapy device that provides intermittent traction, and by providing the intermittent traction, it relieved the pressure on the discs, and the discs went back into place, which was real neat. But still, even after that, and even before that, I had this chronic pain that was in my lower right back. You know, it wasn't enough to cause me agony, but still, it was a chronic pain that just stayed there. And no matter what I did, it would be treated, and then it would come back, and it would and treated and come back. So I saw an acupuncturist, it's Melbourne Community Acupuncture, Annie Williams, and she gave me a couple of acupuncture treatments. And after the first one, that pain was relieved by probably 75%, and it stayed that way. So there are a lot of different disciplines that treat chronic pain. And sometimes we have to choose which disciplines we want to use and how we want to mix them. And then we also have to find the best practitioners for us to be able to take care of the problems.
I was in a chiropractor's office one day and I picked a book up, and it had a picture of the little girl that was on posters in World War II from polio. And by going to a chiropractor, worked on that little girl. She was only 6, 7, 8 years old, and the chiropractor worked on her back and got her to the point where she could walk. And she has been suffering from polio, and she was a poster child for polio in World War II. And I read about it in a book at a chiropractor's office.
Yeah.
So, you know, we can always hope for something, but there's one other thing I do want to talk about today, and that's I'll break it down and I'll lump it up, and then you break it down and talk about it. Let's go to the area of toothache, and we can talk about cracked teeth or abscess teeth.
Yep.
And as you pointed out, when you got a cracked tooth, you're going to talk about, but then when you get into the abscess tooth, you got something which is called a periodontal abscess and an endodontic abscess.
Right.
So, how about making sure our listeners today can simply understand what we're talking about?
Okay, so let's go to pain for a second. If you have a swollen area of your gum tissue and it's right adjacent to the tooth, so it's right where the gum joins the tooth, that's a periodontal abscess. That ordinarily doesn't cause a lot of pain. If you have a swelling or discomfort that's up at the end of the root, in other words, you put your finger in your mouth and you feel the pain is coming at the end of the root, way up above where the tooth is, then in fact that's likely an endodontic abscess, meaning the nerve of the tooth has died and is shooting pus out through a tube that's going through the middle of the tooth, and it's coming out the end of the root where you can feel it, where your finger is at the end of the root. The endodontic abscess is treated with a root canal. In other words, the dead nerve contents are taken out, and the dead nerve contents are replaced with a rubber type of filling material, and that, for the most part, will take care of the problem.
That's
Personally,
when they take the root canal, when they take the nerve out,
when they take the nerve out,
in?
yeah. And in my opinion, and of course I have an opinion here, the only person that you should see, or for most people, the person you should see for that is a root canal specialist. See an endodontist for that. They have the diagnostic equipment, and they do it every minute of every day. And to my way of thinking, if there's a specialist who can handle the problem, then see an endodontist. And the endodontist is a specialist, and they have microscopes, and they have certain diagnostic things that are not available in many general dental offices. Then you're better off seeing an endodontist and getting the root canal done there.
I want to underscore that, folks. My wife had a root canal and had to have one, and what I got out of it after I talked to her and I talked to the doctor was that there are so many passages up in that root. It's not just one canal.
That's right. We think on the X-ray it looks like it's one canal, but there may be more than one canal.
Yeah, be more, and that's why it's so important that you go to the person that's got the right equipment. Yeah, you may pay a little bit more, but would you rather pay more one time and have the problem solved, or go back 3 or 4 or 5 times to different places and end up spending more money and not getting the problem solved?
It's true.
And this is one of the greatest world failures, I think, Lee, in the practice of medicine, is that dentists have not pointed out to the general lay public how serious mouth problems can be if they're not treated correctly.
Oh, it's true. And we were talking about the sinusitis before. About a half a dozen times per year. And by the way, sometimes this is the patient's fault as well. About a half a dozen times per year, we take out a tooth and there's a hole in the sinus. Now, we can predict that that's going to occur because we can see it on the CT scan. But part of the reason is that the patient says, well, let me keep the tooth, even though I know the tooth needs to come out, let me keep the tooth until it really bothers me. And what happens is they leave it too long, it blows a hole in the sinus, and a hole in the sinus that's going from the tooth area to the sinus is a difficult surgical procedure to close. We have to do it, as I said, 4 or 6 times a year, and it's not a comfortable surgery for the patient to go through. If a tooth can't be treated and it needs to come out, don't hang on to it. I know it costs money, and that is part of it, and that's the main part of it. That's the reason people decide not to do something. But you've got to ask your dentist, if I decide to keep this tooth, which really needs to come out, what's the risk if I keep this tooth too long? And the dentist can tell you. And by the way, there's some patients that I see in my office who are keeping teeth that I say we're never going to be able to do anything for this, and the patient says, well, right now it's comfortable enough to chew on, let's keep it. And I look at it and I assess, where is the damage, and is it going to get you into trouble if we keep this tooth too long? Or can I follow it and treat it at an appropriate time? And finally, when I say, all right, now it's got to come out, it's okay. And there are some teeth that we can let go, and there's some teeth that we can't, simply because of their position in the jaw and what damage it will cause to either other teeth or to vital structures such as the sinus if we keep it too long. So we really have to know what the downside risk is.
Exactly right. And if we put it in another layman's term, let's say that might stop me from going to an expensive steakhouse 6 to 8 times, and instead staying home eating a hamburger patty with Heinz 57 steak sauce on it compared to the steak. I could do that, get that problem fixed, and I could eat the hamburger comfortably, where I sure as heck couldn't eat that steak comfortably if I had the kind of problem you're talking about, because you couldn't bear to put the pressure on it. So people have to wake up to what the cost of medicine is, not only in terms of what it comes out of the pocketbook, but what it does to them physically.
It's true. And let's understand that the costs are greater for replacement of the tooth than for extraction of the tooth. Extraction of the tooth will take care of the problem. I mean, if it's that severe. All right, if we have to replace it, and we have to do dental implants and bridge work or something like that, of course that costs more money. But all we're talking about, take care of the source of the infection first. Extract the tooth, or do a root canal tooth, or whatever needs to be done. Take care of the infection first, and you'll be fine.
Okay. What's your last comment? I'll give you the last chance. You got 40 seconds.
We got 40 seconds?
Yeah.
Have a good time. Happy January 14th. It's great to be with all of you and great to be with you, Joe. Helping Seniors in Brevard County is doing a great job for this community. Please support it.
Thank you very much. Thank you, Lee, for doing the show today. And thank you, Vince, for running the panel today. This is our second show of 2016. There's a lot of good things going to happen, folks. Read about them in Hometown News. Go to our website, listen to our radio show, and watch the TV shows on Channel 499. See you next week. Bye-bye.